Your skin is basically a living story, written right there on your body. But how in the world do doctors actually learn to read it? Well, today we're going to put on our detective hats and figure out how to decipher the clues our skin gives us, and maybe solve a few medical mysteries along the way.
It's almost never just a quick glance. Believe me, there's a real method to the madness. It's a systematic investigation that can turn the smallest, most subtle signs into a crystal clear diagnosis. It's a pretty fascinating process, and we're going to walk through it together, step by step. Okay, so before we can crack any cases, we need the blueprint. Every good detective has a process, right? And for a dermatologist, it's a very structured approach that makes sure no clue ever gets overlooked.
It always starts with your story. That's the patient history. Then comes the physical exam, where they're basically hunting for clues. Based on all that, they form a hypothesis. You can think of it as a list of suspects. And finally, more often than not, they need a test to confirm who the real culprit is. It's simple, it's logical, and man, is it effective.
All right, you ready? It's time for our first case file. Let's call this one the sun damage detective. We've got a patient, we've got a lesion, and we have a mystery to solve. Let's open the case file. Our subject, a 68-year-old man, someone who's spent a lot of time in the sun over his life. For 3 months, he's had this persistent, scaly patch on his cheek that just won't go away. Now, the really crucial clues here are the feel of it. It's like sandpaper. And it's slightly indurated, which is just a medical term for hardened. These aren't just details, folks. These are the breadcrumbs of our investigation.
Okay, detective, it's your turn. You have the evidence right in front of you. What is your single most critical next move? Do you just prescribe a cream and kind of hope for the best? Run some blood tests? Or do you need to get a closer look? Think carefully, because this decision is a big one. And the correct answer is a shave biopsy. You have to get a sample. Why? Because here's the absolute #1 rule in dermatology. You can never judge a book by its cover. What you see on the surface could be hiding something completely different underneath. A shave biopsy is pretty much exactly what it sounds like. A doctor uses a special blade to just shave off a very thin layer of the lesion. That sample then goes to a lab to be examined under a microscope. It's basically the dermatological equivalent of getting fingerprints from a crime scene. It's that important. And this slide shows you exactly what's at stake. Here are our 2 main suspects. On the left, you've got actinic keratosis. Think of it as a precancerous warning shot. On the right, squamous cell carcinoma, an actual developing skin cancer. And here's the kicker. To the naked eye, they can look identical. But under a microscope, the difference between them is the difference between a warning and a full-blown crisis. So you see why just prescribing a cream is a terrible idea? It's like wiping the fingerprints off a weapon. Sure, the spot might look better for a little while, but if it's cancer, all you've done is given a dangerous criminal a head start. The biopsy isn't just a step, it's the only way to get the truth. It provides certainty. Case 1, closed. Let's move on to our second case and see how this builds. This one is totally different. It's not about a single suspicious spot, but a widespread, intensely itchy rash. We'll call this one the eczema trail. Our next case involves a 30-year-old woman who says she's had sensitive skin her whole life. The clues are classic: an intensely itchy rash right in the crooks of her elbows and behind her knees. You can actually see the signs of chronic scratching. For anyone who's ever had a rash like this, you know the itch isn't just a symptom, it's the central, maddening villain of the story. Now, that chronic scratching leads to something called lichenification. And this is a brilliant way to picture it. The skin literally gets thick and leathery, with exaggerated skin lines, almost looking like the bark of a tree. This is a secondary clue. It's not the rash itself, but the result of the rash. And this is where the detective work gets really, really tricky. The crime scene has been contaminated. All that scratching, all that thickening of the skin, the lichenification, is like evidence being tampered with. It's hiding the original culprit. So the question for us is, what did this rash actually look like at the very beginning, before all of this happened? And the answer is papules and plaques. Before all the scratching, the condition most likely started as small raised bumps, which we call papules, that then merged together to form larger flat-topped patches, known as plaques. And this distinction is one of the most important concepts in all of dermatology. You have primary lesions, how the problem starts, and secondary lesions, which are the aftermath. A great dermatologist has to have almost X-ray vision to look past all the secondary noise, the scabs, the thickened skin, and mentally reconstruct what that primary lesion looked like. It's about finding the true cause, not just treating the messy results. So piecing it all together, the location, the patient history, and the primary lesions leads to a diagnosis of atopic dermatitis, a very common type of eczema. The trail has led us to our culprit. Case 2 solved. So, after cracking 2 very different cases, what have we learned about the detective work of dermatology? Well, it's really all about adopting a certain mindset. So, what's the secret code to thinking like a dermatologist detective? First, context is king. Age, history, lifestyle, it all matters. Second, details like texture and location are never random. They're specific clues pointing you in the right direction. Third, you have to see through the aftermath to find the origin story. And finally, and this is the big one, when in doubt, test. Don't guess. Now, the point of all this isn't so you can diagnose yourself at home. It's to help you become a better witness, a more informed observer of your own body, so you can give your doctor the best clues possible. It's a powerful thought to end on. Your skin is communicating with you constantly, and by understanding a little bit more about its language, you become a more active partner in your own health. So, what story is your skin telling you?